Good evening to all. The Dr.M.V.L.Kothari Chair and Division of Medical Humanities and the Gosumec Alumni Association, under the patronage of Dr. Sangeeta Rawat, Dean, St. G.S. Medical College and KM Hospital, welcome you to this session of Reminiscences. I request the tech team to play the video about the Division of Medical Humanities. St. G.S. Medical College and KM Hospital will be celebrating its centenary soon. As we prepare for the centenary celebrations, we have a message from our Dean, Dr. Sangeeta Rawat Manu, in the form of a PowerPoint presentation. I request the tech team to please play the PPT. It is the students, past and present, that make our college what it is. So, as our twin institutes move towards their centenary, we wanted to give a virtual platform to every batch of GSMC to share their fondest memories of college. Their thoughts and emotions will be preserved forever in the form of these reminiscences. To remain connected to our alma mater and informed about the activities in KM, including its centenary celebration, we request you to become members of the Gosumec Alumni Association, which is the official alumni body at SAGE GSMC. All the details on how to become a member and this membership form are available on the KM website. All those who are not members are yet requested to please visit the KM website. I request the tech team to display the collage showing the student members of GOSUNION.
Hello?
Today, I, Muskan Chabria, 2020 batch, final year, SAGE GSMC and KM Hospital, will be handling the session.
Can you hear me? Hello?
Yes, so you are audible.
Okay, I'm Navin Nanda. I'm in the badge 1956. Okay.
Yes, sir.
So are we having this meeting for a particular badge or it's a general meeting, Gosumec meeting? Hello?
No, sir, this is a meeting for your batch.
Which badge?
So this is a meeting for your batch, not it's not a
Oh,
general.
I see. Okay. Is there anybody coming on? So far, anyone has come in?
So I am there and Dr. Natarajan sir is present.
What's your name? Didn't get it.
Sir, I am Muskan Chavria. I am from the final year batch at
I see.
KM.
Oh, okay. I was just thinking if there's somebody else has come in yet or not yet, Yeah.
Natarajan sir, can we start the meeting?
Sure. Mhm. You want me to say something?
No, sir. I will. So I will be asking a few questions, and
Okay. Sure.
as and when people join, they can answer those questions to you.
Sure. Mhm.
So my first question is, why did you choose the profession of medicine?
Why did I choose what? Sorry, I didn't get that. What did I
So
choose?
why
What?
did you? Yes, sir.
Huh?
Why did you choose the profession of medicine?
Oh, why did I choose the profession of medicine? Because I think I was very much exposed to medicine because my father was also a physician. So received very good exposure. And so that is the reason I chose medicine. Mhm.
Okay, that's great to know, sir. So my next question for you would be, was there any particular reason for you to choose St. GS Medical College?
I think at that time there were three medical colleges in Mumbai. One was the GS Medical, the other one was the Grand Medical, and the other one was the National Medical College. And I think GS Medical College had a very good reputation for being very clinically oriented. And JJ did not have that much reputation. And National Medical College, if I remember right, came a little bit on the third side. So that's why I chose the GS Medical College. Initially, I got admission into Grand Medical College, but then I got an interview at GS Medical College, and that's why, and I was able to meet the dean and then got into the GS Medical College. The other advantage was, since I was a non-Bombayite, the GS Medical College had a hostel had one room per candidate, one room for each person. While on the other hand, in JJ Medical College, they used to call it parasites. There used to be one person, but 4 or 5 people used to share the room. And at some point in time, they were not even sure who was owning that particular room. So that was the another reason to choose the GS Medical College.
That's great, sir. That's good to know. So my next question for you is, what was your first impression of our college when you first came for admission, or your first
Uh,
impression?
yeah, I think the first impression was it sounded like a very good medical school from our side, and the dean appeared to be very strict, though, Dr. Venksakarkar. He asked me a couple of questions, and I think I was so excited to be in GS Medical that I don't think I was able to answer those questions, but still I got in anyhow. And so it was a good impression at that time of having a GS Medical College. And of course, the hostel was also very good, which was very close right there, just in the same grounds. So the very good impression I had of the medical college at that time.
Okay, I got it, sir. Uh, so do you have any memories of the admission process? And if yes, then what are they?
You're talking about any memories? Is that what you say? Memories? Like
Yes, sir. Yes, sir. Of the admission process.
no, admission process. Don't think there's any other memories except for just getting that interview with the dean, which was like 5 minutes or so. And I can't remember the name of the person who used to be there with the GS, who was the assistant to the dean. I mean, in the I think he was in the staff there. But he was very good person, and he explained to me everything and told me that the teachers are not as strict as they as it when he thought the dean was very strict, but other teachers were not so strict, and they were very good for you. And then the first impression was in the anatomy class and physiology classes. And then anatomy class, I think we had Dr. Kurulkar, who was the chief of anatomy, and Dr. Desai was the another one. He was really very strict, but Dr. Kurulkar was much better. And in the physiology department, we had Dr. UK Shate and Dr. Montero, and both were very good. Dr. Montero was even very friendly with the students. So I think in the beginning, anatomy and physiology was the first two subjects we had, and we had very good impression, very nice teachers at that time. And also there was Dr. C.K. Deshpande, where he used to look at some of the specimens. We used to look at them with a microscope. He used to look at them, and he was also excellent. Mhm.
Thank you, sir. Sir, would you like to tell us a little bit about yourself and your journey till now?
Beg your pardon? Say it again. Sorry, I missed that.
Yes, sir. So, would you like to tell us a little bit about yourself and your journey till now?
What I'm doing now, you mean, is it my job now?
Yes, sir. I mean, your entire journey till date.
Oh, sure. Well, what I did I think we graduated in 1961 or 60. The degree was in 62 because we had to go to Palghar for, rural internship before we could get a degree. And then after 1962, my parents were still in Kenya. My parents were originally from India, but they were in Kenya. And so I went there and did my internship in King George Hospital, King George 6 Hospital in Nairobi, Kenya, for about 1 year, like 62 to 63, something like that, 62. And at that time, my father wanted me to join his practice because he was going to retire and go back to India. to do some charitable work, which we did in Jaipur, Rajasthan. But I thought that it might be better for me to go for some postgraduate studies. So I applied for a Commonwealth fellowship, which gave us some money to go abroad and be there, and a stipend also. And I got admission in the All India Institute of Medical Sciences in Delhi. But the institute was not had just started and was not really something I wanted to go. And so I decided I requested my transfer before I went there to GS Medical College, where I'd graduated before. So I arrived in GS Medical College in 1963, and then in 1966 did my MD in GS Medical College under Dr. Professor K.K. Date, who was actually very strict person and a cardiologist. And so that's how I got interested in cardiology from him. He had spent many years abroad, maybe 10 or 12 years abroad, getting all the degrees from the United States and all the degrees from United Kingdom. So he had many degrees, and that's why I stayed in. So I worked with him first as registrar, and then I think as senior cardiology registrar. And at that time, we established a one-room CCU also, and this was in Ward 9. I don't know whether the Ward 9 is still there in GS Medical in the KM Hospital. So we had Ward 9 there and stayed with him and worked with him. At that time, the ward was divided. The first half was under Dr. K.K. Date as the attending honorary physician, and the other side was Dr. S.P. Golola, who was very famous at that time because I think he had also treated very famous actress Madhubala. He was a physician to her also. And so I worked there. And around that time, we had published a paper on something like hyperglycemia after acute myocardial infarction, which got published in the New England Journal of Medicine, which is a very difficult journal to publish at that time. Even now, it's very difficult to publish. As a matter of fact, there's only paper which had in India published in that journal, none afterwards. And so, because of that paper published there, I was able to obtain actually a position of assistant registrar and cardiology fellow at the National Heart Hospital in London and the Institute of Cardiology in London. So where I stayed there for 1 year. And then after that, I migrated to United States in Rochester, New York, where I got very much interested in echocardiography and did some work in echocardiography. And then after about 13 years, I was attracted to go to University of Alabama at Birmingham. And in 1984, I left Rochester and joined University of Alabama, Birmingham as the director of their echo laboratory. And I was the director for 31 years from 1984 to 2015. And then I kind of retired and joined again. So I'm kind of semi-retired, but working about 50% of my time in Birmingham. And my title is Distinguished Professor of Medicine and Cardiovascular Disease in that institution. Sorry for the long-winded answer to your question.
No, sir, it was actually very interesting to know your entire journey. We're really happy to know that.
Yeah.
So my next question would be, what was the physical layout of the campus during your time? And
What was the what? Sorry.
yes, sir,
Was the
what was the physical layout of the campus during your time?
Yeah, the campus was actually quite roomy in a way because I did go to visit KM Hospital later a few years ago, and it's very crowded now. It's very roomy at that time. There was a tennis court between the hostel and the museum, which was there, and the dean's offices. And then, of course, the hospital was right next door, so it was much more roomy, and I think a little greenery was also there. Which I didn't find that much now. It's a lot of buildings have come up. The CCTV, the cardiovascular research, center, as we called it, was across the street from KM Hospital. Had just come in at that time. By the time I was there, it had just come in, and it was supposed to be a big cardiovascular research center. And even now, it is there. I think the last time I went there, I saw that it was a very nice place, much more crowded than used to at our time when we were medical students and registrar.
Okay, sir. So my next question would be, which faculty members taught in each department during your time, and what changes occurred during your time?
Yeah, well, I'll talk about the department. I mean, the communication not very good because I'm in United States, so the Zoom is not that well. But anyhow, I hope you can hear me more clearly than I can hear you. Well, the ward, actually, there was a Ward 9. I've not been to. I didn't think I went to Ward 9 again, which is a small ward, and Dr. K.K. Date used to do his rounds at that time when I was a registrar. And what a very interesting thing was that he was cardiologist, but he had to ask a general medical question to the batches that I was into. My batch were working under me, and so you have to ask only one question: what is the course of the seventh cranial nerve? And everyone used to kind of read thoroughly, kind of memorize it 100 times. I made them memorize 100 times. But as soon as they come near Dr. Dutt, they froze. They forgot everything. So they were very nervous about him because he's a very strict person. And he used to always have a bow tie and a suit. And I don't remember seeing him in different suit anytime, always a new suit. So he was a very imposing figure, short guy, but very imposing figure. So they all used to forget about it. So he used to give everybody zero. This was 0 out of 50. And the other 50 were for instruments. And I was, as a registrar, used to give them. So what I used to do was to make sure nobody failed just because they could not answer his question. I used to give them 50 out of 50. So I used to show them the instrument gave 50 out of 50. And so they used to pass. And Dr. Date never used to look at how much score I gave. He just looked at the bottom line. It's okay. He just signed something. He thought they had failed and he would be, but he didn't realize that I had passed them already. I was caught once there because at the end because said somehow that he looked at the score and said, "How come I'm giving everyone zero and you are giving 50 to them?" And I said, "No, they're very good. And I mean, I saw them; they're very good, and they just forget things in front of you." And he just called one of them and said, "What instrument Dr. Nanda showed you?" And some other, I think I used to show them just flatus tube so everybody can see flatus tube. And so as to say they're correct, flatus 50-50. So he said flatus tube. And this is the first time I've seen the very strict Date just smile, he laughed. But somehow he didn't fail that batch and pass that batch also. So that was one interesting story I had about Dr. K.K. Date. The one other interesting story was that when we published our paper in the New England Journal of Medicine, Dr. Date had many degrees. So, in those days, even when you do the research, the first name you always used to give to your mentor, to your honor, to your mentor. So I put down Dr. K.K. Date and Nanda. And once the paper was published in New England Journal of Medicine, I was very proud and I showed it to my mother, who knew some English, did not know too much English, but enough to look at the heading. And it was Dr. K.K. Date, and he had many degrees. And then there was my name. So he said, "Well, what are you very proud about this whole thing?" As a matter of fact, if you look at it carefully, you look like one of the degrees of Dr. Date only. So don't just be brag and don't be very proud of this. So I was really deflated. But it did look like I was one of the degrees of Dr. Date because it was said Dr. K.K. Date, the MD, FRCP, Edinburgh, London, etc. So DCH. I don't know what other degrees he had, DTM and H, something from United States. And then it was, and Dr. Nanda. But that paper was a very good paper. And it had also an editorial from New England Journal of Medicine as the first thorough study of an Asiatic population looking at hyperglycemia and its relationship to diabetes mellitus. And because of that, I think I went to the National Heart Hospital in London. But I need to tell you one other story also here. So when I asked Dr. Date for a reference, he gave me a very three-line reference. He said, "Dr. Nanda was working with me for as senior registrar for 3 years, and he is hardworking, conscious. I recommend him." So now that's two-line references. In those days, our references had to be at least a page or 2 pages. And Dr. Date's reference was 3 lines. So I was very disappointed. I showed to Dr. Ivan J. Pinto, who was the assistant honorary. He was very, very friendly with me. And he said, "My God, I can't believe it. We all kind of were very disappointed, kind of abusive, also some of them for Dr. Date. And Dr. Pinto wrote a 3-page reference for me. And then Dr. Asfi Gholwala, who was on the other side, whom we just knew, he also said, "Why, this is too much. Let me give you a reference." So he gave another 2-3 page reference to me. Then I got selected, and I thanked Dr. Pinto and Dr. Gholwala. Just said, briefly thanked Dr. Date, but knew that his reference was the worst one. And I must have got selected because of Dr. Pinto's and Dr. Date. And we had other attending, Dr. Madhu Deshmukh there. And I think I can't remember all the names, but some of the attendings were there. So when I went to National Heart Hospital, the first thing they asked me was, "Oh, Dr. Date recommended you. That's why we took you here." So it was very interesting because Dr. Date was very well known to them, had been to National Heart Hospital even before me many years ago. So they knew him. And his 3-line reference is what got me, not the many pages references from other honorees. I almost fainted there. But then I realized, and I think then I met Dr. Date several times. I think at one point in time, Dr. Pinto called me when I was in India saying Dr. Date is dying. He was in Bombay hospital, had liver cancer. So I met him, and he was mentally very, very alert, although physically not good, but mentally very. And the first question he asked me, "I hope while you're in university, you're still working hard and very conscientiously and doing research." And I said, "Yes." So even then, he was the same old Dr. Strict, Dr. Date that I knew him a long time ago. Thank you very much.
Thank you, sir. It was really interesting to know. So we have another member who has joined,
Yes.
Poddar, sir. Can you hear?
Ramesh Poddar from your
Oh,
batch.
hi. How are you? Hey, Ramesh.
Hi. Hi, Nanda. How are you?
Oh, good. My God, I'm so glad to see you,
Yeah, my pleasure.
Yeah, are you still in Panvel?
No, I'm in Dadar.
Oh.
Dadar now.
Oh, Dadar. I thought you had gone to Panvel and then you came back to Dadar, right?
No. I'm in Dadar at one place. Here, charger. Nanda.
Oh.
My wife wants to see you.
Hello.
Whether you are the same and maintain the weight same way.
Long time, yeah.
Okay. Charger, charger. Yeah. So how is life?
Good. Life
I
is
heard
okay.
your story, which I knew partly, except
Huh?
the last part of
Yeah.
Dr. Date's death.
That is, yeah, right. You look very good. You look very fit. So that's great, yeah.
Yeah.
Mhm.
I'm fit like a fiddle, fortunately.
Yeah, great.
Hi, Dr. Natarajan. You're taking too much trouble for us, man.
Yeah,
No,
we were
sir.
friends, but we never met actually after that, after many
Yeah.
years. Long time, yeah.
Yeah, long time.
Yeah.
We've got all your photographs and all.
Oh, good. So when I come, I'm planning to come somewhere in November.
When are you coming?
I'll meet you there,
Let me know.
November or December, I'll come, yeah. So you need to send me your phone number or some contact.
Yeah, I'll send you.
Yeah.
How do I send that? But where your phone number is the same?
Yeah. No, my phone number is, I think I can, it's a WhatsApp number is like +1.
Hey, phone me 1 second. Hema.
Yeah.
I'll copy it. Yeah.
Yeah.
1 second, not tell me.
Yeah.
Kagat pen dena.
Yeah. So it's +1. Then
1 second.
Okay, sure.
Yeah, tell me.
Yeah.
America.
America, yeah.
+1.
+1, then 205.
205. That is Atlanta or somewhere else?
No, it's Birmingham, Alabama. 807.
Alabama, yeah.
807.
Yeah.
0731.
0731.
Yeah. What is your number? Give me your number.
98. You can take down 98201.
98201.
83. 454.
454.
Yeah.
Okay, I'll repeat it.
10 digits, yeah.
Yeah, 98201.
201.
83454.
Yeah. And 91 is the country code. before
yeah.
that is necessary.
Yeah, I'll call you as soon as I reach India in
Please,
Bombay.
please,
We'll meet each other. Yeah,
before
sure.
coming to Bombay, then I'll receive you with open hands and garlands and all.
Where? In Dallas? Oh,
I'm at Dadar. Anyway, we'll meet, no problem.
yeah, sure.
Yeah,
You are now in Dallas, actually?
Dadar, same old place. Dadar, that is a suburb of Mumbai.
Dadar. Yeah, right.
Dadar station, where we stood in Great Punjab, the same Dadar.
Okay, are you near? You used to stay very close to that old Pritham restaurant. Are you still?
Yes, very close, walking distance.
Yeah. I know. I remember that place. Yeah.
Yeah. I remember you taking mithai, loads of mithai for wedding of your daughter or son from Amritsar and going that time. After that, we are not met.
Right.
So, how are you keeping well?
I'm keeping okay. Yeah. So far,
Very
so good.
good.
How about you?
Very well, no problem.
Okay,
I had one
good.
stint about 10, 12 years back, but recovered immediately before the attack came and fine.
Oh, okay,
So
great.
I've had my lot, but now I'm absolutely fit and fine.
Okay.
Yeah, I'm now still practicing a bit, but mainly in the NGO which I was working with, I've told you. I'll give you information later on what we are doing and all.
Okay.
Good.
Is your son, wasn't your son taking over your practice at some time?
No. My daughter has become a gynecologist. Her
Yeah.
husband is an ENT. They have taken over the hospital and I
Yes.
practice there free of charge.
Oh, very great.
So they are looking after. One of my daughters is in England, in Cardiff. She is a rehab specialist and her husband is an orthopedic surgeon. My son is an LIC person.
I see. Where is your
daughter?
Where is your daughter?
Now going to America, but she is a Spanish teacher.
Oh, I see. Oh, very good. Great.
So all of them are well, all of them married, all of them have kids, and I'm enjoying the green part of our lives.
Oh, I see. Great. So where is your daughter now? Where does she live now? In which place?
Who?
Your daughter, where is she living?
She's in England, Cardiff.
Oh, England, Cardiff. Yeah, that's what you mentioned. Cardiff. Yeah.
Cardiff, yeah. They stay in Abergavenny, which is in Wales. So she has to travel for 1 hour.
Yes.
They've been in England for about 15 years. They
Mm-hmm.
have 2 kids. They have also graduated. So everything is going on well.
Okay, that's
So
very
let
good.
me know, when are you coming? But roughly November, December.
Yeah, in December and November, I think I'll be coming in the last week of November.
Yeah.
I will just, I will meet you. I will call you and meet you
Okay,
before.
okay.
Oh, yeah.
How about any other friends there?
Hmm?
Dhirubhai,
No,
where is Dhirubhai?
Dhirubhai is here actually. Dhirubhai just we talk to each other every week. He's in US only. His wife Shashi Karnik died. Shashi Karnik.
Really?
She died. She had some blood cancer, so she died.
Oh God.
So he lives with his daughter, and he's still okay. He's still communicating with me. He's a little bit forgetful now, but he's still okay.
All of us are in that group.
Yeah, right. And Kutub Saifi is
good that we recognize each other at least and remember.
Kutub Saifi is still there. Now
Randive. I'm very happy to see your face.
Yeah, Randive is in some old people's home now, somewhere in Carolina. Randive, and so Dhiru Desai, we talk to each other every week or so. We talk every week. Dhiru Desai.
Yeah.
We talk with him. We talk every week, Yeah,
very nice.
And
any contact with SR Shah here?
No, SR Shah died, no?
No, I don't know.
Yeah, SR died a long time ago. He died quite a while ago. He had a heart problem, but he did not want to get angioplasty. I don't know what the question was. For some other type of medicines, and then I think he died. SR Shah died, yeah. We're very sorry to hear that,
Yeah.
SR Shah died, yeah. Anand Shah is still there. Anand Shah is in Anand Shah in Boston, near Boston. He's still there.
Oh, I see. Yeah, good.
Yeah, he's still there. Yeah. Chandrakant Shah is also there. I don't know whether you remember him. Chandrasekhar Shah.
Yes.
Yeah.
So
I don't know what happened. I heard something. Sesha went to Canada, but I don't know much about him. I don't know what happened.
He was a neurologist and is working in Canada. That's what I heard last.
Right. That's what I heard.
In Toronto when I met him. But This Kumud Patil, you know Kumud Ingle?
Who?
Kumud Patil, Kumud Ingle.
Yeah, Kumud, yeah.
Kumud Patil was in our class, gynecologist.
Yeah, right, right.
She died recently. Suddenly a heart attack on a swimming pool. And before she could get into water, she died at Shivaji Park.
Yeah.
About a couple of years back.
Yeah, she actually
We are
came
losing our team.
to Birmingham. She came to visit me in Birmingham many years ago. She came here.
Oh, Atlanta, Birmingham.
She was here one day with her, some other relative. They were here, you know. Yeah.
Yeah. See, her daughter is in England, and my daughter meets her occasionally. Yeah, she's a
I see.
gynecologist there in England.
Oh,
Yeah.
Jagdish is still there. Jagdish Patil
Jagdish Patil is still in that place wherever he was, and I
Kentucky.
met him a year back when he came. He has severe diabetes, but he and his wife, that Daftari or somebody, they came and I met him. Somebody had organized a get together, so I attended.
Yeah. Right.
He's
right,
the
right.
same. He's in Kentucky, I think, somewhere.
Right.
Yeah. Who
Yeah.
else do you remember anywhere there and here? Melmane, I have no contact.
Oh, where is he, Melmane? Is still here?
He's in Chembur, but I have not contacted him much.
Okay, is that okay?
Yeah.
Okay. Anybody else you think?
Oh.
You know, Ashok Parmar was in.
Yeah. Parmar is longest and Parmar is brevis, we used to call them. Parmar
Yeah.
is brevis. Longest is in America, tall fellow. And the other one is in Villeparle, retired. He's got a son. He was practicing gynecology.
Right.
He's in Villeparle East. He's all right. I've not met him, but his son is in a very big post in pharma concern. So he is a friend of my son-in-law. So he keeps me informing about how they are.
Oh, okay. That's great.
Yeah.
That's great. So we definitely
Hello.
one day, whole day, I'll come and meet you there in Dadar, you know.
Sure. Then by which time I'll get information from Natarajan and try to contact everybody and hold a live meeting if possible.
Yeah, right.
And hello, can I interrupt, sir? Just a
Yes,
second.
please. Not interruption, pleasure.
No, Dr. Gajanan Chanbag from your batch.
Where is he? He has come back to India?
No, he is very much actively trying to join the Zoom, but I
Then?
don't know what difficulty he is facing. Because
I
I
see.
could have, so in case you, meaning any of you is in touch with him, can give him some idea as to how we can join the link. I sent him the link.
I see.
So I don't know. And one Dr. Harsh Dahejia, roll number 1.
Yeah. Then
And
Dahejia had come here for about 6 months. I don't know whether still is here. But he and Sudha Gangali married, you know that? You remember?
She married Harsh Dahejia, no? Harsh Dahejia.
Sudha Gangal. You know the girl better than the boy, huh? Anyway, so still old habits not gone.
Ramesh sir, hello.
And I think
Sudha Gangal.
years ago. I have not been in touch recently with Dahejia.
But Dahejia is in Ottawa.
Ottawa,
In fully in Krishna consciousness or Krishna thing. He has opened in Bombay a small section in Prince of Wales Museum on Krishna.
Yeah.
So when you come, we'll try to visit there, if he's there or otherwise also.
I see. Oh, great.
Yeah.
Okay.
I met him, we had a lunch together. But after that, he went away, I think, back to Ottawa. He's in Ottawa.
okay, can I interrupt once more?
Yes, please.
Dr. Muskan is the student coordinator.
Yes, I could recognize, yes.
She was interviewing Dr. Nanda because nobody else had joined at that time. So maybe if you could recall your memories, Dr. Ask you questions. Muskan.
Sure.
Muskan, are you in the line?
Yes, sir. Am I audible?
Yeah, you're audible. Please go ahead with questions to Dr. Poddar.
Yes,
sir.
Okay.
Yeah.
So, Dr. Poddar, would you like to tell us a little bit about yourself and your journey till now?
Yeah, about myself and what?
And your journey till date in medicine.
We spent all of us spent about 11 years of our life in the 4 corners of KM hospital. Actually, till I got really tired, I said every day in and day out, what is the future for us? And when I joined Nair as honorary assistant pediatrician, Every day I used to remember, my God, KM was so much better, KM was so much better. Till 5 years, I could not identify with Nair. Then I started feeling that Nair is my place. Till then, while we were in KM, we used to hate the same place, same canteen, same Sahyadri, same watchman, same corridors, long corridors. Walking, when I became the first houseman in pediatrics, we were only 2 housemen, 1 on each side. And I was with Dr. Pilu Bharucha. Those of you who know her, she was a friend of Dr. K.K. Date, but she was not a friend of others. Certainly not her juniors, though I had a special place in her mind. But, as a houseman, we had to keep list of everything, all investigations of children ready for a round next day. So, walking for pathology report in one direction, complete end. Walking for X-ray report in another direction at the end that time. So I very quickly learned the art of finishing the job while you're walking, which is still with me. Now, if I see anyone on the road, I say, have I any work with him? Then I walk further. So that is how I have learned how to be efficient while working. So this is what KM has given me. Correct? Nanda, you remember those days in Ward 9?
Yeah.
When we used to wait till the boss came and took us one by one. Cardiology registrars and cardiology people were in. You remember that chap? Who was it? That registrar who threatened to jump from the window. You remember that? No.
Yeah, right.
I forget his name. He was, Dalvi's note case was there and Dalvi complained. You remember the story? See, there was an assistant honorary called CP Dalvi who had come from abroad or something. He was an officer there. They were scientific officers before they could take up the post.
Yeah, right.
So he had sent a note case, and this, our registrar, he was in charge of the medical ward, and he had written some medicine. I think, remember, he had written aspirin for enteric fever.
Yeah.
So, our doctor friend, shall we call him X, he said, I will not give. As long as I'm there, I will give my treatment. So next day, Dr. Delvi complained to Dr. Date. Says, sir, they are not listening to me. So Dr. Date called him. He was a very strict man. He said, you must listen to whatever he says. He says, when I am in the ward, when none of you are there, this is the reply to the chief. Sir, I am the registrar. I am in charge of this ward whenever you all are absent, and I will act as to whatever is needed for that patient. Now, for example, as your boss, when I've come to the hospital, you can tell me to jump from this window. And he went and stood on the sill of the window. Sir, tell me to jump and I'll jump just now. I will take your orders. But not when you all are not there. We'll do what we want. So Dr. Date got so shocked. He says, okay. Doesn't matter. And he closed the chapter. I don't know if you remember, he was a medical registrar with Date during our time when we were there.
Yeah.
He's a physician now somewhere practicing.
Yeah.
So we had good time at KM. Nanda and myself had a very good time. We used to go to, you remember me and Nagendra used to go and eat at various places. Go at Great Punjab. Go Taj that time. If you remember, Taj had started a lunch, executive lunch at 12 rupees per person. 12. This is in 1958 or so, 58 or so, 58 and 59. So 3 of us used to go. Nanda was quite plump. I was middle. Nagendra was thin. So 3 of us used to go and eat at Taj, then go and have cake in somewhere else, go and have sweet dish or dessert somewhere else, Batorelli. We had a lot of time together, 3 of us. You remember that, right?
Absolutely.
Yeah, those days. Thank you for giving these memories, Natarajan.
Yeah. I think
so I became a pediatrician, and then I've been fortunately, though I had passed my ECFMG, and they said up to 7 years you can come anytime and pay the fees and join. But fortunately, I got positions one after another here, and I was landed up in Nair as honorary and had practice at Thane and all. Nothing to regret about. But still, I remember our days of when I was a cultural secretary, when we had invited Meena Kumari, Mohammad Rafi, and all those memories are still with us. So I meet a lot of people who still know that. But it was a good life.
Yeah, very good. Yeah, very nice. Yeah.
Yeah.
Thank you so much, sir. So my next question is for Naveen, sir. So would you please like to tell us your contributions in echo-radiography in the US?
Oh, my contributions, I think what happened was that when I joined...
Before that, I will tell you one story. Okay, I'll tell you one story. Muskan,
okay.
Listen to me.
Yes,
See,
sir.
when in 1976, this is related to your question. In 1976, when I went first time to America, I had no contact with him. I said, but I must meet Nanda. He was a very close friend. We were parasites of each other many times in the hostel room. When I get a room, he would sleep in my room. When he gets a room, I would sleep. So that was a relationship. And in 1976, I had no clue as to where he was. But I knew that he won't keep quiet. His records in KEM, he used to write papers so fast, one after another, thanks to Dr. Date and his compulsions. So I went to library, KEM library, and searched the December issues of Indian American Heart Journal, Circulation, and all heart journals. And sure enough, in December issue where they give an author index, I found Naveen C. Nanda. And then from there, I got to which hospital he was. He was, I think, that time at Birmingham, Atlanta. And then I traced him and then gave him my phone number and met him and stayed with him, and we had a good time. So I could trace him because of his publications, which he learned very early. And as you know, in America, you publish or perish. He did not perish. A lot of other people must have perished, but he published. And he was always the first one to try all the echocardio machines and bring out papers before all his competitors. I mean, he will not tell you because he's too humble and too polite to tell you all these stories, but I can tell you as a friend of his. Now tell him now to talk, Nanda. You can talk now about what she has asked you.
Okay, well, what happened was that I learned cardiology with Dr. Date. Then I did again cardiology in England. So when I joined Rochester, again, I had to do cardiology and internal medicine and cardiology both. And so I was kind of a little bored. So I don't know what to do. But then I was just learned something about echocardiography at that time. There are 4 valves in the heart, and 3 discovered before, like mitral valve, aortic valve, and tricuspid valve. But the 4th valve was supposed to be under the lungs, so it was not easy for us to do it with echocardiography, which cannot penetrate the lung tissue, as you know. And there was a cardiologist in South Africa called Dr. Chesler, and he mentioned that you can never get the pulmonary valve. So that is going to be a big problem with the echocardiography in the future. But around that time, I had gone to see an autopsy of patients, and the pathologist told me that the pulmonary valve is not under the lung, especially if the pulmonary artery is dilated. It's always around near the lung, but not in the lung. So you should be able to find the pulmonary valve. So I went, and with my mentor at that time, a guy called Dr. Raymond Gramiak, who was a radiologist, but he did echocardiography at that time. So we together said, let's try to see if we can find the pulmonary valve. And what we did was, luckily that patient had a big heart, pulmonary hypertension. So we were able to see the pulmonary valve, and then we were able to move the transfer. It is different from the aortic valve and not the same as pulmonary valve. And then we went into the cardiac catheterization laboratory. That patient was undergoing cardiac catheterization laboratory. So we injected some indocyanine green, which we can see on echocardiography. And during that time, we could clearly prove that is a pulmonary valve. So we were able to actually, for the very first time, detect pulmonary valve on the echocardiography. And that's how pediatric cardiology was born, actually, more or less. Pediatric cardiology got born because then we could diagnose transposition of the great vessels. These are the cyanotic kids. And as soon as the blue babies were born, most of the time they had to wait for cardiac catheterization long time, and many of them died before. But right now, with echocardiography, we could immediately diagnose transposition of great vessels. So then in the cardiac catheterization laboratory, they could go and enlarge the atrial septum and make sure that there was good blood flow between the atria, and so the kid survived. And then later on, there was another Indian cardiac surgeon in Buffalo who had actually invented the cardiopulmonary bypass in children, in newborns. And Dr. Subramaniam, I think it was. I think he's also from KM, if I remember correctly, long time ago. And then so therefore, so many babies were saved, and that's how actually pediatric echocardiography was there, but not that much popular at that time. But now with this new pulmonary valve discovery, we could diagnose transposition of the great vessels and many other things. And then some other, we also diagnosed congenital bicuspid aortic valve, and also we invented treadmill exercise echocardiography, introduced for the first time in the United States color Doppler in our laboratory in Birmingham. So we did some of these work here, and as a matter of fact, because of that, I was able to, go to Birmingham. I was attracted by Dr. John Kirkland, who is a very big cardiac surgeon at that time. Even now, his textbooks are read everywhere. So he and another Dr. Pose attracted me to Birmingham, and that's where I am. So in very brief, I just wanted to let you know. So once I found the pulmonary valve, a lot of people from Mayo Clinic came to check with me and say how you can find the pulmonary valve. And so this all mode echocardiography at that time. So we showed them. And so that's why I got very much interested in echocardiography. And that's how I decided to stay in USA. Otherwise, I was thinking of returning back to Mumbai. But at that time, with all this interest and a lot of people coming to learn from me and a lot of people inviting me to show how to get the pulmonary valve. So I just stayed in Birmingham and did some other work in echocardiography. Okay?
Thank you so much, sir. That was really interesting to know about your contributions in echocardiography. My next question would be, what were your memories of the cultural activities like Avishkar or Orgy?
I'm sorry, didn't get that question again. Can you tell me again?
Yes.
Sorry.
Yes, sir. What were your memories of the cultural festivals like Avishkar, which is the official cultural festival of GS Medical College?
Well, I don't
Hello,
think
can I interrupt here?
really
Can I interrupt here?
festival ever.
This Avishkar and all that started in the 80s. So
yeah,
sir
but
would not be.
Yeah, but during the Cardiological Society of India meeting till recently, there was always a get together of say GS Medical College alumni. So I used to always attend it for many years. This was all in the Cardiology Society. And but I think 2 or 3 years ago, even 1 year before the pandemic, I think they stopped doing it. Otherwise, they always used to let me know where the meeting is. So I always used to attend the meeting and meet many people from KM in cardiology at that time. So that's all I can tell about that.
Okay, so thank you. My next question would be, what were your popular student hangout spots in college or even outside of college?
I'm sorry, tell me again. This is not the best. Yeah. Mm-hmm.
Yes, your favorite student hangout spots in college.
Student handouts? Is that what you're saying?
Yeah, where you used to hang out after college.
You mean in GS Medical College?
Yes, sir.
I don't remember any handouts at the GS Medical College being given out. Ramesh, do you remember?
What?
No, sorry. I'm asking about the hangout spots, maybe the canteen or any other hangout spots where you're.
No. She's asking about HANG, not HAND. Hangout.
Yes, I think we used to frequent canteen quite a lot. That's for sure, And actually, Dr. Date was quite upset with that. He said he always used to find me in the canteen. Always used to ask people where Nanda, and he's in the canteen. He used to say. So he was always afraid of that. As a matter of fact, when I got promoted from a registrar to senior registrar, the only time we could talk to, I'm just aside here, to talk to Dr. Date, when he was walking from Ward 9 to all the way to, then he'd take the elevator, which is opposite Dean's office, and then take a left turn, and then he goes to his car. When he used to do this, so we could talk at that. So once when the post became vacant, I was going with him, and I said, Dr. Date, there is a post of senior registrar. I would like to check that. he says, but you are just always in the canteen. I said, yes, sir. You're the best person. I said, yes, sir. You have to say yes, sir, to Dr. Dade. Never agree with him. So he kept on saying yes, sir. Then he went down the elevator. Then sir said the dean's office right opposite. Okay, I'll go. So he went there and appointed me as senior registrar. So that's how it. Just give you some idea about what was happening at that time. Yeah.
Ramesh, sir, do you have any favorite hangout spots in college?
No. No handouts. But I remember during our undergraduate days, you understand,
Yes.
all hospitals were competitive with one another. KM, JJ, and Nair. Sion was not there that time, came later on. And we had professors. He was talking about Dr. Montero. Similarly, he talked about Dr. Golwala. So Dr. Golwala used to take us, he was an examiner in pharmacology. So he used to take us lectures and lectures of questions and answers that are likely to appear in Viva and practicals. I still remember those amphitheater was full of all KMGS boys. And I was sure that since it was happening in our college, that our students were a little extra trained by our professors, I knew it must be happening in other colleges. So I made friends with a friend who was in my batch, my peer, Meenakshi Mehta in Nair Hospital. She was merchant that time. And we used to exchange notes of each professor. So both of us used to benefit in the examination. So there was no handouts. We had to study all ourselves. There's nothing ready-made for us. And use of library. But now I think the whole thing has expanded so much that we cannot believe that how, as a pediatrician, how we managed to survive so many children. That was really IV fluids, how we would give. Unbelievable. Mrs. Barucha was fond of subcutaneous saline. So we have survived some children with subcutaneous saline, age old, because, and therefore when I was the registrar, I used to, in KM, if you have seen Ward 1 was the only one. One side was Dr. Bhagat, the other side was Dr. Barucha. My patient, she used to come for round. So what used to happen is, those where I had given IV and all, we used to shift those patients on other side to Dr. Bhagat's side. And when the round, Dr. Bhagat asked their registrars and all, what is wrong with him? He says, no, this is Ramesh's patient. He has kept it on our side for some time till the round is over. Then we'll switch them back. We used to play all these such tricks, which was necessary for the patients, in spite of the idiosyncrasies of our bosses. You understand? Otherwise, the death rate would have increased to much more than what we had sustained. This is just in joke that I'm talking, but this is true. How only now when you see all the facilities, we were 2 housemen, one on each side when I joined pediatrics. And the last time, about 3-4 years back, I went to Nair and I went to Sion. There were 32 residents, 40 residents in each unit. My God, what a luxury. I envied them, but I was happy that the patients were better cared for than what was in our times. That is our experience. Because the number of patients were too many.
So it was nice to hear about in the context of handouts. But
what handouts? I don't understand what you mean by handouts.
No. Muskan hangouts. HANG, meaning time pass at KM.
Oh.
Hangout. Okay.
There was, what Nanda says is right. Dr. C.P. Dalvi had come from Indore. And he used to boast that he used to play cricket and all. So we used to deliberately ask him, and the students also asked him, sir, tell us about your Indore trips and how you played cricket. So he would take us to canteen and tell his stories, and we would have good stuff in the canteen on his account. I still remember that. He was a boastful man. May God give him a lot of life, but we used to use him. We had good fun at KEM. KEM was supposed to be studious. I don't know how it is now, but we had whatever fun we had during our time.
And I remember once you had said that the Naigaon hostel, it started during Naigaon hostel, boys hostel.
Ah,
That was Beggar's home earlier.
Naigaon, it was a Vegas home. And there were number of students were more at the hostel. So they shifted us there. Then it was new, but terrible it was. I stayed for about 6 months there in Naigaon. I was a Bombay resident, so I was at the, the down in the list, not up on the list, because outsiders would get a preference. But we had a good time at the hostel, that Aryan Club parties, feast on Sunday, and especially RMO quarters, Morris, you remember Nanda?
Yes,
Morris
yes.
used to cater to us. Very nice man. Like our guardian in the wilderness of medical hospital campus.
Yeah, he was a permanent person, permanent person. Yes.
He would keep like what mother keeps us. He used to keep for the resident who doesn't come in time. He used to keep his food warm and all at night for him to eat. Nice person.
Very good person, yeah.
Thank you, sir. So actually, I am currently posted in pediatrics. I'm in my final year, so I think it is
Very good. Where are you doing?
So I am a final year student at St. GS College.
You want to take pediatrics?
I am interested, but I'm not sure, sir. But I'm currently posted in pediatrics, so we go to.
Very good.
We enjoy it a lot.
Very good. Good scope. Good
so
scope. Now a lot of new branches are coming up, and there is good scope for serious student to go up. A lot of things are new now, and the field is widened all over. So go ahead. Which college you are? KM only?
Yes, sir.
Very good.
Very good. Great.
Thank you, sir. So my last question to both of y'all would be, what were your fond memories of dissection hall in anatomy?
Pardon?
Your memories of the dissection hall in anatomy in your first year of medical school.
Anatomy?
Your dissection hall memories, yes.
I can't get you. Speak loudly a little bit.
Hello, am I audible?
Yeah, speak loudly. You are audible, but little less.
Yes, I was asking about any fond memories that you'll have about the dissection hall in anatomy in your first year.
In the first year when I joined, after we were exposed to the cadavers room and for dissection, within a month, about six or seven girls left the medical college. They felt giddy, somebody felt sick. So new vacancies came up. That was a good thing that was happening. But no, it's like a routine. We could buy skeletons. Things were quite easy for us, except that the grey was too big to carry and to read. But there was no alternative with that. Because Gray and McGregor, with these two books, any surgeon can do wonders in his life. That was what we realized. I don't know what these boys and girls read now. Basic Cunningham, Gray, and McGregor surgical anatomy. That was great for us. In anatomy, Manu Kothari was in, if you're asking from that point of view, he was about 2-3 years senior to us.
Right.
Kothari, Kokhani, all their KVS together. Yeah. And he took to anatomy because of either his love for it or whatever circumstances might have forced him to take that. And he's shown up very well. I don't know where Kokhani is. So he was very senior. But one of the main things that he had, I think, detected that straight leg raising sign with psoas abscess, which was published in surgery textbook. What is the surgery textbook? What is the surgery textbook you all read?
Surgical belly.
The standard one is Bailey and Love.
Love and Belly, yeah. Love and Belly, it was included, and his name was there in the footstep that he is during his undergraduate days, he had diagnosed and proved that a straight leg raising sign is an early sign of psoas abscess following tuberculous spine. So that was great of him. And because of that, I remember another story. You know, when I was a registrar from England, a person who has written a monologue on tuberculosis, you know, from Newcastle on Tyne. I forget his name. And he had come and he had visited us. So my boss, Dr. had kept, we used to have brain cutting lessons with Dr. Deshpande, who's in Bangalore now, neuropathologist. When he saw the number of cases with a number of brains with so many multiple, single, big ones at odd places, tuberculomas, I still remember he sat on the chair like this and introspected like meditation. He had never seen a case of tuberculoma, and here is one who wrote a textbook on tuberculosis. So tuberculosis was not known to them at all. One of our residents went to America and she could smell, you know, those people who work with us could, as Nanda would say, that we can smell TB, meningitis and all from outside. So much of practice we had as pediatrician. So she told their staff that this is TB, meningitis. They said, no, we'll do the lumbar puncture, we'll culture the bacilli, this, that. And then the child died. Then they realized that he had TB, meningitis. So our clinical experience is beyond imagination that any other world that we can take. I remember Dr. Arthur Disa. Nanda, you remember Arthur Disa?
Yes, sir.
Once in outdoor when we were chit-chatting, I mean, this is for you, Muskan. While there was a outdoor, surgical outdoor, we were attending. This was our first, second term also of surgery as undergraduates. And we were chit-chatting, spending time here and there, whiling away time. When he came, he fired us. He was a very decent guy, very well-spoken guy. He said, you all do not know what you all are missing. Don't chit-chat. Go and see this huge line of patients waiting in our waiting corridors. Ask them what is wrong with them. Check them up. They will have thyroid. They will have lumps all over. They will have something in the abdomen. Ask them. Take their history. Examine them. If you don't do it now, and when you pass your examination here and go to England, you will have to pay through your nose to ask a patient to allow him to examine before your examination. Here they are all lying free, waiting for your attention, and you all neglect. So these are the lessons that our teachers gave us, which gave us success, isn't it?
Right.
Yes,
right.
sir, absolutely.
You all also don't spend your time. During undergraduate time, you must try to learn. And mainly clinical medicine, because so much of clinical material, nowhere in the world except maybe Africa, you will get. You understand? That is a message I would like to give you.
I remember one instance, you know, in anatomy, we had Dr. Koelkar was the chairman, the head of the department.
Kurulkar.
Yeah, but we had Dr. Kalgutkar, Dr. Bhatnagar, Dr. Pereira,
KD Desai.
Yeah, they were, but Dr. R.D. Desai was very, very strict. So once we had read everything in anatomy he had told us to read everything about the heart. We read it. And then he asked us, what is the vertebral level of the heart? And none of us knew that, because it was not there in the Cunningham, in the book itself. So he failed all of us. We had to go repeat the whole exam because even now, because of that, even now I remember the vertebral level of the heart is 4th to 8th vertebral body. It is still in my mind. Anytime anybody to wake me up from sleep, I'll say, I know exactly where it is.
You-
So remember it thoroughly, and that's how I felt. They also, the Dr. Adi Desai was Dr. Kovelkar. I don't know whether you remember Dr. Kovelkar.
Very
Kothari.
well. He
So
was
he
the
was,
first one to pass SFNG and start the
Yeah.
exodus from us.
so when he was, Dr. Desai was examining, he asked him many questions. Every question he asked, he couldn't answer. So he took a bone, some femur or something, and hit him on the head. So another question, then Dr. Kovelkar thought that he will really get injured here. So what he did was his long line, I mean, it's a long corridor, long room. Dr. Desai is the very end, and the door is on the other side. So Dr. Kovelkar decided to run away. So while he was getting examined, he got up from the seat and ran away. And Dr. Aditya told the ward boy to get him, and ward boy could not get him, and he ran away completely. So that is another thing, very joke. We used to laugh a lot about that because he was a very strict person, Dr. Aditya Desai, Yeah.
You remember Haridas Shenoy?
Yes.
Haridas Shenoy, Specs fellow. He's
I
no
know.
more now, but he
Yes.
was my in our class. So in anatomy examination, Dr. Kurulkar asked him to show on the pelvis, bony pelvis, where the ischial tuberosities were.
Yeah.
So he was fiddling with the pelvis. He did not know from hell where the blessed ischial tuberosities are. So he said, you are sitting on them, man. Dr. Kurulkar said, you are sitting on them, you are sitting on them. So this guy coolly gets up and looks on the chair what is there. So we laughed and he was so strict, but he laughed and then ultimately passed him or whatever it was. But then
See,
I will never forget that
you remember
sitting on your tuberosities.
Yeah, Dr. Pendarkar, I don't know whether he's still in Pune.
Pendakar is in Pune, chest physician he became.
Yeah. So
He's still practicing there, yeah.
Dr. Pendarkar, when he was with Kurulkar, he pointed to something. What is this? What is it? He said cerebrum. So he said cerebrum? No, he said cerebellum. Cerebellum? No, he said cerebrocerebellum. He couldn't be. So this is very funny.
We can't imagine that we have gone through all that now, isn't it?
Yeah.
We can't even tell them except each other.
Right. So Dr. Pendarkar is still in Pune?
He's in Pune and practicing as chest physician. I've not met him lately.
Oh, I see. Okay.
There was a chap called Dr. Parulkar, dentist, used to come to our room. Remember? Pendakar's friend, dentist.
Right.
He was a dentist for celebrities and all. Amitabh Bachchan and Rajesh Khanna and all. He died recently. He was my good classmate.
Okay.
So Pendarkar used to tell him, he was a dental student, he was not a member. So he used to come at night to stay with many of us. So when Pendarkar, he said that I want to stay here. So Pendarkar said, you go anywhere, but don't stay in my room. So he was very, very outspoken.
Right.
There was that we had a registrar called Deshpande, from outside in pediatrics.
Right.
So she went and she had some pimples. She was a pediatric registrar, and he was doing a term in skin. So she went and asked him what to do. So he said, plus, before that, you tell me, how is your sex life? So she got so shocked. She came and said, look what he's talking and all. I said, it is his clinical history he has to take. We had a lot of fun there. We had a lot of funny fellows.
Yeah. In RMO quarters, I used to share the room with Dr. Borade.
Yeah.
He's, I think, was in Chicago.
He's in Chicago. He was in MS, Chicago. He used to come here very often, but last 5-6 years he has not come. I don't know whether he's alive also, but because he was senior to us, na? But I used to meet him for a long time.
Yeah, Dr. Pyati is also in Chicago, but I've not been in touch with.
He has been operated heart replacement and occasionally contacts me, but I don't know him lately. We are all become old, no? Do we keep contact and talk?
Sure.
Yeah.
So Dr. Borade, I think 2 years ago, 3 years ago, I remember talking to him, but recently I asked one of the cardiologists who is there, and he says he has not seen him, but he has retired. So he's somewhere there only, most likely.
Oh, must be there. His daughter is on the Facebook, what is her name? And his daughter is quite frequently comes on Facebook. I want to contact her sometime.
Okay. She's a medical
No,
person?
non-medical. She is she's an ophthalmologist married to an American ophthalmologist.
I see. Oh,
All his
okay.
children are medical. First daughter is a lung transplant specialist, twice done lung consultancy, and she's very big celebrity in the lung field. His
Oh,
son is a radiologist. Both of them are not married. This youngest one is married.
oh, I see. Oh,
Yeah.
great. And Pyati, have you been in touch with Dr. Pyati at all?
Patty, once in a while, maybe once a year or so, he is well settled. His daughters are well settled. Son was doing some job there. I have not met him, but I should visit him once in a while when I go to there, Chicago.
Okay.
He came to my daughter's wedding, Survi, but that was in June and it was so hot that poor fellow, after the marriage, next day he said, I must go back, otherwise I'll fall sick in the heat. So he went away, but he came and attended wedding of my youngest daughter, Survi.
Yes, okay. So both Dr. Borade and myself were registrars with Date also, you know?
Yes, yes, he was medical registrar.
Yeah. Yeah. Our one of our main jobs, in addition to other duties, was to give Dr. Date tea every half an hour. He used to have tea every half an hour. He used to round very quickly and then stay 2-3 hours doing research. Dr. Date, KK Date would round half an hour and then come back and then every half an hour we would give him tea. If we didn't give him tea every 1 hour, he'll get mad. You know, he'll get very angry. So we used to be quiet with him because he's quite an angry person. So every half an hour we used to give him tea. He used to be a little bit quieter there, you know. And anytime he used to get angry, like with Dr. Pinto or someone like Dr. Pinto used to go out immediately and then find Dr. Deshmukh and say, Dr. Date wants you. So we'll get Dr. Deshmukh, Date. And Dr.
Pinto is a great guy.
Yeah, and Dr. Deshmukh could tolerate Dr. Date very easily. He never used to come out.
He never used to take anything seriously, so he was happy.
Yeah, so he could
Dr.
easily.
Date was friendly with my boss, no, Pilu Barucha. She could handle him well.
Yeah, right. Dr. Baruch, the husband was my examiner in MBBS final. And the other examiner, the external examiner, had gone to, I think, to the bathroom. And so Dr. Baruch, he knew us, of course. He said, is this liver enlarged? I said, yes, sir. Do you think this is cirrhosis or something? I said, yes. Then is this? Yes. So by the other examiner came in, he said, I have already examined, he is passed.
Same thing once Golwala did to Patty. You know, Golwala was the examiner and the other fellow had gone out. The outside examiners received local phone calls very often. So he had gone out and he asked Patty some question. And Patty did not know the answer. So he told him also the answer. Right? By the time the examiner came, then Golwala asked him this question again. So that expecting that he will answer properly in front of the other examiner. So Patty, like a fool that he was going to say, sir, you have already asked me, you know. So when he says, sir, and Golwala could see that this fellow is going to say that this question has been asked. So he kicked him under the table. Golwala kicked Patty under the table. So Patty realized, I must keep quiet. He says, yes. So he says, no, he's done well. I have told him, so he went away. Yeah. So all our teachers used to help us tremendously.
Sure, absolutely.
Not really ethically or spiritually correct, but that is life. Student life is student life.
Yes,
I don't know whether Muskan, you all experience this or no. I don't know.
Yeah.
Yes, sir, we surely do experience a lot of things here.
Okay, well, thank you very much.
So we have...
calling you. I'll meet you in November in Mumbai.
Yeah, sure.
And thank you very much for arranging this. Otherwise, it would be very...
So please, 5 minutes.
Just 5 minutes more.
Yes, no problem.
Yes. I request the tech team to please play the video on reflections.
Okay,
very good evening to you all. It is indeed my pleasure to speak about Reflections on Medical Humanities, annual volume published by Dr. Manu.V.L.Kothari, Chair and Division of Medical Humanities, Gosumec Alumni Association, under the patronage of Dr. Sangeeta Rawat, Dean, St. GS Medical College and KEM Hospital, Mumbai. The first issue of Reflections was published in the year 2019. the theme being History of Medicine, Looking Back to Improve the Future. The book comprises invited essays, poems, cartoons, quiz, crossword, and articles which were published before in different medical journals on evolution of branches and development of specialties in healthcare, great personalities and inventions in medicine and healthcare overall. The issue for the year 2020 was based on interpersonal relationships in healthcare. Again, invited essays and cartoons on doctor-patient relationship, doctor-doctor relationship, and medical teacher-student relationship were included. For the year 2021, we chose very apt theme of COVID-19, the human angle. Essays and poems in English, Hindi, Marathi, paintings and photographs contributed by teaching and non-teaching staff and students of St. GS Medical College and KEM Hospital who shared their experiences both on personal and professional fronts during the pandemic. The theme for the year 2022 was Literature and Medicine. It is a collection of articles, book reviews, and poems in English, Hindi, and Marathi, and also paintings and cartoons related to the theme. Now, for the years 2023 and 24, the proposed theme is Reminiscences, Our Days at St. GS Medical College and KEM Hospital. As we move towards the centenary year of our institution, let our fond memories come alive in the form of nostalgic writings about our learnings, not only medicine, but also life lessons that we learned here. Let us talk about our devoted teachers who inculcated values and shaped our lives, priceless friendships which we cherish lifelong. Our writings will instill a feeling of pride and a sense of belonging in all of us. The readers of the book, we as well as the future generations of students, will understand the power and beauty of expression and reflections. We will be enlightened about the history and glory of our institutions, past students who have contributed to the welfare of the society, and the role model teachers and mentors. We know, irrespective of the generation, we are bound by a common bond of being GSites. However, we also need to accept and adapt to changes which are inevitable following technological advances and societal transformations. At the same time, the students will learn that even though the changes are occurring, the humanitarian values and principles of ethics are unchanging. Hence, we appeal that the reminiscence and nostalgic memories shared on this platform of virtual reunions be expressed in the form of writings to be included in our next issue of Reflections. I, Dr. Swarupa Bhagwat, Editor Reflections and Associate Professor, Department of Transfusion Medicine at this institution, will be privileged to connect with the individual batch coordinators for sharing more details regarding the same. Thank you very much.
Thank you very much. Great pleasure to be with you all.
Sir, I would like to give my vote of thanks. We'd like to thank our Dean, Dr. Sangeeta Rawat Madam, and Academic Dean, Dr. Pathak Sir, for their continued support and encouragement. We thank the Gosumec Alumni Association for administrative support for correspondence and financial transactions of Dr. M.V.L.Kothari Chair and Division of Medical Humanities. We thank Mr. Tushar and Mr. Badal for audiovisual and technical support, Mr. Matre for video recordings, and last but not the least, a big thank you to the batch for their enthusiastic participation. Thank you so much.
Thank you. Thank you, Natarajan.
Thank you, sir, very much. It was a
All
great evening.
Hamsini, give my regards to Hamsini.
Yeah, thank you very much. Your blessings, sir. Yeah.
Okay.
Thank you.
Hi, Nanda. I still
But-
remember Daddy Apperon, Daddy Apperon.
Yeah, we'll see you. I'll definitely see you in November, end of November.
Yeah, sure.
Yeah, I'll call you before I come. Thank you.
Okay.
Okay. Bye-bye.
Bye-bye.
Bye.